Hello mga kudoks! So today, my vlog is about my review for my PLAB 2. As you all know, I will be taking my PLAB 2 this coming 6th of April. So it's approximately 36 days or 35 to 36 days from this video and my PLAB 2 exam. And by next week, I will be in London in Common Stations for my final review. So, um, this video, I will just show you what we've been doing for the past months. So, we've been reviewing since December, almost every day, 3 to 4 hours. So, we usually usually practice after my work. So, I end my work around 6 p.m. So, I just eat my dinner, then we will go on with our review at 8 p.m. until 10:30 to 11 p.m. So I will show to you what we've been doing for the past month so that if ever you will be taking your PLAB 2 in the near future, at least you will know how it looks like. So in this review, we're using Zoom or Google Meets with my co-foreign doctors who are also taking their PLAB 2 this April. So there are four of us in this group. So it's not really a big group. One doctor is from Ghana in Africa. The second doctor is from Pakistan, a female doctor, and the third doctor is from the Philippines, same as mine. He was my classmate before in medical school. So as of now, we're already done with all the topics in the PLAB 2. If you base it on the table of contents of the if you look at the table of contents of most Shobi notes. So for our review, we've been using the most Shobi notes instead of the common stations notes because it's the common station notes is too thick, and for the most Shobi notes it's not that thick, and there's a soft copy and it's easier to practice. So I think notes doesn't really matter. You just need to practice, practice, and practice, and you should also know the structure of the PLAB 2 of every PLAB 2 scenario. So now I'm just waiting for my other co-doctors to be online so we could start our practice. So let's go. Let's practice. It's only a few days left before my PLAB 2 exam. GEMC number 784. Hello.
Hello, doctor.
Hi, I'm Dr. Enriquez, one of the junior doctors here in the surgical clinic. Are you Mr. Jack Ethan?
Yes, I am Jack Ethan.
Okay, could you confirm your age for me, Jack?
It's 35 years old.
Okay, can I just call you Jack for short?
It's fine.
Okay, so Jack, I can see here in my notes that you underwent a procedure called herniorrhaphy. It was a week ago. I mean, how was the procedure, John?
Oh, wait a minute, doctor. Are you one of the junior doctors?
Yes, yes, I'm one of the junior doctors here.
I don't want to speak to you. I just want to talk to your consultant because I have some concerns and a bit upset with this.
Yeah, yeah, I can see that you're quite upset about something. And yes, I'm one of the junior doctors here. Is it okay that you could maybe tell your concerns to
Yeah.
me?
Well, I had. You should know this probably. I had an operation a week ago.
Yes,
Now
yes.
I have pain and swelling in my site of the operation.
Pain and swelling, okay?
Yes.
How many days did this occur, Jack, after your operation?
Uh, you're not listening, doctor. 1 week ago.
I mean the redness and swelling, did it happen on the same day or did it happen like days after the operation?
Well, it's been like 5 days.
5 days after, okay. Do you happen to know if you were given medications such as antibiotics or pain reliever maybe to address those concerns of yours?
Can't remember, doctor. They only gave me some pain tablets.
Pain tablets. Okay, okay. Did anyone assess your concern about your
No, this is
post-operative wound?
not. This is the first time I've had a follow up since my operation.
Okay. Don't worry, John. I'm gonna assess you later, and hopefully I could manage you accordingly. Is that okay with you, John?
Yeah.
Jack.
Okay, fine.
Okay.
Go ahead.
Okay. So, could you put me up to speed on what happened to your operation? I mean, what made you do the procedure at the first place, John?
Well, like I said, I believe you have that in your notes. I don't want to go back again. Just
Uh-huh.
I'm a bit concerned about this
Uh-huh.
swelling and pain
Okay.
I'm having at the moment. Well,
Okay.
but the surgery was fine.
Okay.
It went well.
How was the service of the doctors and the nurses during your stay, apart from your concern after the operation?
Well, it's fine. Just that now I'm feeling these complications.
Oh, okay.
Um, I'm afraid that it's an infection. I don't know.
Okay, okay. I'm gonna examine you later, but based on what you've told me, it seems that it could be an infection. Could you tell me if there's any? I mean, could you describe the site that you're complaining with? I
Well,
mean, is there any redness in it?
yes. With actually, there's some pus
Pus as well.
oozing
Okay.
out from the side.
Is there any blood in it?
No,
Okay. Do you have fever?
no.
You said you have pain. Is the pain just on your
Yes,
surgical site, or is it on
uh,
your in your abdomen maybe?
just on the side.
Okay. Do you have other symptoms such as maybe problems with your bowel, vomiting?
Oh no, it's fine.
Any
Nothing.
any problems with your waterworks maybe?
No.
Okay, okay, that's good. Um, did you apply anything? I mean, did you take any medications apart from the pain reliever?
No, just the painkillers.
Okay, just the pain.
And I've been replacing the dressing.
Okay, that's
I
good. That's good.
took care of my wounds every day.
Okay, I see that, John. Are you diagnosed with any medical condition, maybe such conditions such as diabetes, hypertension?
No.
Okay. Is this your first operation, or did you have an operation before, John?
Yeah, this is my first operation.
Okay, that's good. Who do you live with at home?
Well, just my wife.
Okay.
Are you asking?
Okay. I'm just asking because in case if you're unable to support yourself in dressing, at least someone could help you with it. Yeah.
Okay, fine.
Okay. So, John, is it okay if I examine you right now so I could assess the wound that you've been complaining?
Well, okay.
Okay, I'm gonna check first your vital signs just to make sure if you're not having fever, you don't have other problems with your vitals. I'm gonna do a head to toe examination, but I will focus more on your surgical site, just to see if there's really an infection going on.
Okay.
Okay. So John, I know that you're quite upset about what happened to you after the operation. And based on what you've told me and based on what I've seen during my examination, yes, it could be a possible surgical site infection. So it's a condition that could possibly happen after an operation, John. And I'm so sorry that this happened to you.
But why did this one
Mhm.
happen to me?
Yeah. So
Supposed to be a clean surgery, isn't it? A
yeah,
simple surgery.
I can assure you that the team did all their best to make sure that the operation will be sterile, or clean, and in order to avoid this kind of complications. But there could be a lot of factors, Jack, causing this surgical site infection, and
Like
some
what, doctor?
um it's really hard to say. It could happen maybe after the operation when you were at the wards, or maybe when you were at home. But I really commend you because based on what you've told me, you've been cleaning it properly. But like what I've told you, this is a common complication, Jack. So there's nothing to worry. We could do something about this. Are you interested to know?
Yeah, like what, doctor?
Okay. I'm gonna let my senior assess you as well. Maybe we need to take some cultures on your discharge, on your wound, and maybe we could start some antibiotics to prevent further infection. How does that sound, John?
Well, it's fine, doctor, but I still don't understand why this happened to me. Because if you mentioned that the bug was in the ward, so that means the nurses were unclean or dirty.
Okay. I mean, I understand your concern, but I can assure you that the nurses and the other personnel coming into your room are doing aseptic technique, or they're cleaning themselves before they go to your room, or they, wear this protective equipment to make sure that they don't contaminate you, John. So I can assure you that.
But doctor, I don't want to. Am I be admitted or getting admitted or not?
As of as of now, I'm gonna let my senior assess you. We might start you on antibiotics. What's your vital signs? I don't know what's your vital signs if it's stable.
Normal.
Okay, so maybe we could just start you with some oral antibiotics as of now. But I'm gonna ask my senior if you need to be admitted. It's really hard to say. Um, you know, I didn't see your wound. Just-
Doctor, is it happening a lot in your hospital?
Okay, that's a very good question, John. So we make sure in the hospital that um, we're following the national guidelines on, on post-surgical infection. We do some monthly meeting to make sure that everything in the hospital regarding infection is controlled, and it's not increasing in number and those stuff. So I could assure you that we're doing everything to prevent this kind of infection. But even though we do everything, these things could still happen, Jack.
Okay, that's fine, doctor. Can I speak to the consultant now?
Okay. I could give your message to my consultant.
Because I
Um,
want to complain, to be honest. I want to complain.
okay. So John, it's your right to complain. I'm gonna refer you to a section called Pulse. It's a patient advised liaison service. You could explain everything. You could tell your concern. If you want to complain, that's your right. That's fine, John. I could help you with that. But rest assured, in our part, we're gonna file an incident form, and we will also have a meeting with my senior about this. Okay, John.